Thank you both for joining us today. Today we have Dr. Kelsey Larson. She's an assistant professor of breast surgical oncology at the University of Kansas, and Dr. Eric Campion, who's an assistant professor of trauma, critical care, and acute care surgery at Denver Health in Denver, Colorado. Thank you both for joining us today.
Happy to be here.
Thank you.
We're going to talk a little bit today about the paper competition that both of your chapters run in Kansas and in Colorado. So start off, Dr. Campion, why don't you tell us a little bit more about how your chapter puts on its yearly paper competition?
For us, since we were really just getting this going from scratch after several years of not having anything going, we used one of our local surgical societies, the Denver Academy of Surgery. We partnered with them since they already had a meeting set up that we could use as the paper competition. And having that collaboration between our two organizations worked out really well.
You talked a little bit about how you solicit papers. Dr. Larson, what about your organization? How do you guys set up your competition? How do you guys solicit papers?
ACS Kansas has been very fortunate that we've had annual meetings for some time, and the resident paper competition has been part of that really for a very long time. We have specific calls for abstracts that go out about 2 months in advance, and we send those not only to all of our resident and staff members, but also to the individual program directors for every residency program in our state, making sure that they're invited to submit. And we also welcome submissions from medical students as well. So if there are any other medical students that have worked on projects, they're invited to present. And we have really 2 tracks that people can choose to present. There's a trauma focused track and then a cancer and education focused track. And by doing that, we actually have prizes in each of those tracks. So the requirements for a submission are much the same, but it helps us to distinguish a little bit and get some variety of papers and have a couple different competitions that happen with the abstract submission.
I think that tracked pathway is really very interesting. Yeah. Dr. Campion, does your organization do anything like tracking? Do you have medical students or different levels of trainees involved?
Yeah, so we opened up the paper competition to the residents initially, although we did have some ability for medical students to present. We kind of left the competition for the residents. And we did have tracks, and we actually did a clinical science and a basic science track. Since we felt that those were significantly different and kind of needed to be judged differently, we ended up doing it that way. And that's how we split our competition.
You talked a little bit about having those 2 pathways because they're judged differently. Maybe Dr. Larson and Dr. Campion, you could each talk a little bit about what judging criteria do you guys look for when you're deciding what papers to accept? You obviously can't give away the details of, who wins first prize, what the judging criteria are, but just as kind of a generic thing for residents and medical students who are thinking about submitting papers. What are the types of things that you guys look that make a good paper that you would consider accepting into your competitions?
The way our process works is we first accept the abstracts, and their abstract criteria are pretty open. It has to be a page long, and in that page, you can have whatever you'd like, a table, a figure, all words, whatever it might be. And so there's a little bit of creativity in terms of communicating your data and your science. But we expect that the abstracts that are submitted follow a typical format, so the background, methods, results, and then conclusion or discussion. And we basically look and review and ensure that everyone is clearly identifying their research question or the purpose of their research, clearly describing what their methods were. And then in the conclusion, we especially like when people are basically saying how this might relate to practice or how it might relate to the next steps or further study that needs to be done. So we get really excited when we see papers with those criteria.
We actually judge papers very similarly. We have a very open abstract, again, without a lot of real strict criteria, just the basic format that Dr. Larson just described. And I think relating it back to clinical practice is very helpful, especially for the clinical science papers. And because of our collaboration with our local society, we have a lot of judges, as far as the faculty that are not necessarily academically based. And so I think it really speaks to them when things, relate back to the actual clinical practice. So I think that is something we definitely look for. And then, of course, we look for things that are new and novel as far as the abstract.
Wonderful. And then I guess kind of to wrap it up, while we've got two master clinical scientists here with us today, what advice would you give for medical students and residents who are interested in getting involved in the academic process? How do they reach out to find mentors? What's a good place to start for clinical research projects?
Just reaching out is step number one. Just putting your name out there and speaking to the faculty and saying that you're interested and you'd like to take on a project, you'll get one pretty quickly, at least around here.
And you can look at the Department of Surgery website for your institution and look for people who are called research coordinators or research administrators within the Department of Surgery. Those would be other good points of contact if you don't know the faculty themselves. The GME is also a great point of contact, so they often know who is publishing and who's working with trainees on projects. And finally, I think the residents are a really good source. So if you're not sure which staff you want to approach, or if you're a little nervous approaching a staff to start off with, approach some of those mid-level residents or those senior residents you might have interacted with and ask who does research. You might be taking something on and they can kind of guide you and direct you, or at least make an introduction. And that sometimes helps smooth out that process.
I think those both are really great ideas. I think especially for medical students and junior residents, the concept of getting involved in clinical or basic science research can seem really daunting. They don't necessarily have an idea of their own that they want to research, but are interested in learning more about the academic and scientific process. And so I think that the recommendations both of you provided can be really helpful. And I think the ACS chapter paper competition offers a great way to get your work out there. The peer review process can be a really long and lengthy process and can go through multiple revisions. And the paper competition is an opportunity to present your work and to also get some feedback on your work. Can you talk a little bit more about the feedback that residents get after their papers are submitted to the competition?
We try to have as many residents present as possible. We really want everyone to get that experience. And so this past year, we're able to accommodate all the residents that put in a paper with being able to get a short period to present. And we won't be able to necessarily do that every year, but we really try to be very accommodating. And then we give the residents some feedback after the competition. Mostly, not necessarily real formal written comments, but we'll kind of talk to them about, hey, this is an area you might want to talk more about, and we always have a question and answer session. That's where most of those kind of comments come out.
My personal initial experiences doing oral presentations were with the ACS Ohio chapter when I was a resident. And from there, I learned a lot about what makes a good presentation and a not so good presentation. And we want that to be that outlet for our trainees as well. And so we try our very best to accept as many as we can to accommodate those into our schedule and into our calendar during the meeting, and to give everyone as much as possible chance to do an oral presentation, because we want you to practice with us and have that coaching with us so that you're ready when you get your national presentation.
I think you both very well said the benefits of these local paper competitions. Not only is it an opportunity to get a little bit of notoriety for your own work within your local community, it's great practice, you get feedback, and it's your opportunity to kind of expand your comfort and kind of get your first breaths into clinical and academic science. Thank you so much to both Dr. Larson and Dr. Campion for being here today. And everyone has a great day.
Thank you for having us.
Thank you.